Well, if you or a loved one has ever undergone a medical procedure or required certain prescription drugs, you're probably very familiar with something called the prior authorization process. That's when insurance companies have to approve certain tests or treatments before you can get them. This system has long been criticized for causing delays, sometimes endangering patients' health. Mm-hmm. In response to widespread concerns, a coalition of major insurers has pledged to reform the prior authorization process. And joining us now to discuss these developments is Dr. William Soliman. He's head of the Accreditation Council for Medical Affairs, an organization that actually helps the people who have to say yes or no to prior authorization, yes. Right?
Yep.
Thanks for being here. This has been criticized for years. I know it's very frustrating if you, the patient, or a loved one is waiting for something to get prior authorization. Why is it so tough for there to be meaningful reforms in this process?
Well, one of the things that people don't realize is that the number one reason for care delay in the United States is prior authorization. So 93% of the time when there's a care delay, it's because of a prior authorization. Mm-hmm. And why it's very difficult is that our healthcare system in the United States is a very complex process. And that's number one. Number two, a lot of the people that are actually trying to process those prior authorizations, they don't know how to do it. This is not a thing that's been educated, they haven't been educated or taught.
It's their job and they don't know how to do it.
Yeah, a lot of it is just handed down, it's like oral kind of tradition or, information handed down from person to person. So really until the ACMA came into existence, there was no codified process for how to submit a prior authorization. Now, in their defense, one of the challenges, though, is that the pharmacy benefit managers, the insurance companies, they make it hard. Okay, yes. They make it difficult to, be able to get these prior authorizations through the system and to get them approved. That's also important to understand. But there are reforms that are, being proposed in Congress to try to streamline this. But unfortunately, a lot of that is related to technology changes and digital changes with AI. And as we saw with United Health Group, at least allegedly there, sometimes those algorithms can actually push more prior authorization denials so that more patients have a difficult time getting access to important medications they need.
Yeah, it'd be nice to have humans involved in that process.
Exactly, yes.
And also Agreed. A process, right? Mm-hmm. Well, the coalition promises reductions and streamlining. How significant are these changes in practice and what impact can patients and providers expect?
So one of the things that people don't realize is in the big, beautiful bill, there was actually a provision to try to reform PBMs. But unfortunately, that provision, when it got to the House, was removed. And what people don't realize is today the PBMs, the pharmacy benefit managers, those middlemen are really the primary player in driving up healthcare costs and prescription drug costs.
Really?
That's the major, because the way a PBM works is they make money based on the list price of the drug by the pharmaceutical manufacturer. So when a pharma company, let's say, says this drug is $1,000, the PBM basically gets a cut of that. They negotiate a percentage of that. So if you think about it, the higher the drug price, the more of a rebate the PBM gets. And so this is why I think, to the Trump administration's credit, they've been trying, even in the first administration, to try to streamline and reform what's happening with PBMs. But again, unfortunately, in the last, provision for the big, beautiful bill, that was taken out. And so I think we still a long way to go in terms of seeing reforms as it comes to prior authorization.
So where does this leave patients? And if you've been denied prior authorization, what's your best course of action?
So the best course of action really is to make sure that you have good relationship and communication with the team at your doctor's office. So, making sure that you're working with the billing department, that you're encouraging them, pushing them to, put an appeal through to the insurance company. Because a lot of times, because it's so difficult, they may not want to do that because it's just a very cumbersome process.
Well, do you think these reforms are going to alleviate any problems, or do you think we're just going to see more problems on top of this?
I think we won't see any change anytime soon, unfortunately. I think we're trying theoretically to move in the right direction, but realistically, relying only on some of the technological changes may speed up some of the prior authorization approvals, but we're still going to see a lot of denials. And here's the thing. Most of the drugs approved by the FDA today in the United States are specialty drugs. They're very expensive. So I think you're going to see more prior authorization denials. Insurance companies are going to push back even harder because they're more expensive drugs to want to cover.
Yeah.
We'd like to get to yes more often than no.
Exactly.
Obviously.
Yeah.
All right, Dr. Soliman, thanks for being here
Thank
in
you
the
for having
diner
me.
on Connecting Medical.
Thank
We
you.
appreciate it.
Yeah, thank you.